All right, let's dive right into this explainer. Today, we're going to respectfully break down a highly sensitive but absolutely crucial topic: the medical realities of late-stage ovarian cancer. We're drawing directly from the expert insights of Dr. Yashi, an incredibly experienced obstetrician and gynecologist, to shed some light on something people often find really hard to talk about. But avoiding the conversation doesn't change the reality. And as we're going to see, having a clear, structured understanding of this disease, it's literally empowering. So I want to kick things off with a really important question. When ovarian cancer progresses, what actually happens to the body and the mind? And why is knowing this hard truth the absolute key to supporting your loved ones? I mean, why look at the hardest parts of a disease at all? Well, honestly, understanding the unvarnished medical truth is the most compassionate way to prepare everyone, patients and their families, for the road ahead. It lets us prep mentally, physically, the whole shebang. Knowing what's coming gives families the tools to maximize their precious time together, instead of just being totally blindsided by sudden medical shifts. Which brings us to part 1, the harsh reality of ovarian cancer. To really build a foundation here, we have to immediately address what makes this specific disease so uniquely challenging. Now, there's a huge misconception out there. People often think, okay, we finished the surgery, we did the chemotherapy, the patient is completely cured forever, right? But the reality is that ovarian cancer frequently spreads by seeping into the surrounding areas. It's what doctors call dissemination throughout the abdomen. So even after a massive surgery to remove the uterus, the ovaries, the lymph nodes, and that layer of abdominal fat called the omentum, and even after a completely successful round of chemo, the recurrence rate is still exceptionally high. It's an illness that demands ongoing, vigilant management. Grasping this right from day one is absolutely vital for managing expectations. Let's move on to part 2, repeated recurrence and emotional care. We really need to see how this medical reality translates into a massive emotional roller coaster for everyone supporting the patient. If you visualize this recurrence cycle, it's basically an exhausting yo-yo effect. Now, unlike some other gynecological cancers, Dr. Yashi points out there's actually a vast arsenal of chemotherapy drugs. Think of them as weapons that are highly effective against ovarian cancer. Which sounds amazing, right? It means that even if the disease comes back, patients can pivot to a new drug and potentially hit remission all over again. But think about that cycle. Taking chemo for 6 months, feeling great in remission for a year and a half, and then suddenly, bam, another recurrence. It creates this intense emotional whiplash. Families, and especially young kids who might think, hey, mom is completely cured now, are suddenly hit with the confusing shock of a relapse. The mind and the body just struggle to keep up with these sudden, drastic shifts. 40 to 50, that's the peak onset age for ovarian cancer. And honestly, this is a profound piece of information. Think about what that actually means. It means this disease is frequently striking women right in the middle of actively raising young kids and managing chaotic households. So when a mom is told she's in remission, the entire family breathes this massive sigh of relief. But when the cancer returns, that emotional devastation is heavily compounded by the sheer disruption to those young, developing family dynamics. And this leads right into a really powerful insight from Dr. Yashi. Because long-term outcomes can be so up in the air with this recurrence cycle, how you spend your time together during those remission phases is absolutely vital. Instead of just living in constant paralyzing fear of the next screening, families are really encouraged to consciously prioritize quality time, focus on those shared experiences, and keep communication wide open while the patient is actually feeling well. It's all about making those moments count. That brings us to part 3, physical symptoms in the late stages. As we transition to the later stages of the disease, we really have to look directly at the severe physical toll it takes. These are the realities families must be prepared for. In those final stages, patients generally face 3 major physical hurdles. First up is severe leg swelling. Because the lymph nodes were removed during surgery and the cancer can actually block blood vessels behind the uterus, patients get swelling so intense their legs can resemble an elephant's. It often requires a wheelchair, which sadly can instantly dash hopes of simple family outings. The second hurdle is ascites, which is fluid building up in the abdomen. And the third is pleural effusion, which is fluid trapped in the chest. By understanding the root causes of these 3 things, families can really begin to grasp the devastating impact they have on a person's daily life. Now, it is incredibly important that we understand exactly what ascites is. Well-meaning family members, They love the patient, right? They often urge them to, come on, just force yourself to eat for energy. But what they don't realize is that this massive fluid buildup is physically compressing the patient's stomach. So eating isn't just unappealing, it's literally physically impossible and can lead to severe vomiting. Recognizing this is a huge game changer. It helps families stop pressuring their loved one to eat and start finding other, better ways to offer comfort that actually respect their physical limitations. Then there's pleural effusion. When you hear what this actually does, it makes it incredibly clear why simple comforts, like just lying down to sleep in a warm bed, become agonizing for late-stage patients. As the cancer spreads up to the diaphragm and the lungs, fluid starts accumulating. The patient literally feels like they are drowning inside their own body. It's terrifying. Often, they have to sleep completely sitting up just to get enough oxygen into their lungs. Moving on to part 4, palliative care to ease pain. Let's pivot and talk about how medical professionals step in to manage these really intense symptoms. At this stage, the absolute top priority is the patient's dignity, their comfort, and their peace of mind. Instead of trying to cure the incurable, doctors shift gears. They utilize this highly effective arsenal of medications specifically designed to eliminate physical pain and mental distress during those final days. They'll use diuretics to help flush out the fluid causing that severe leg swelling. Albumin replacements are brought in to manage fluid balances. Morphine is expertly administered to keep the physical pain completely at bay. And, just as importantly, psychiatric medications are used to soothe the profound anxiety and fear that naturally come with the end of life. Okay, we really need to clearly define palliative sedation because this is a critical concept and there's a lot of misunderstanding around it. Families need to know for sure that palliative sedation is absolutely not about hastening death. Dr. Yoshi makes it clear that this is typically only considered when a patient's natural life expectancy is down to just a day or two, and their suffering, like that terrifying sensation of suffocating from lung fluid, just cannot be managed any other way. It is a profoundly compassionate medical intervention. It's meant to provide a peaceful, resting escape from unmanageable agony. And finally, part 5, early detection through screening. Let's take all of this heavy, critical information we just covered and turn it into actionable, life-saving prevention. Because the whole point of knowing how difficult the end can be is to make sure we do everything in our power to never actually get there. The ultimate takeaway here, it's realizing the immense absolute power of early detection. You have got to take your gynecological health seriously. Establishing a baseline relationship with a primary gynecologist means that the very second something feels even a little bit off, you already have a trusted professional to turn to. Regular screenings are literally your best defense. They allow doctors to catch any abnormalities long before they ever have the chance to spread and create the complications we've been talking about today. So I'm going to leave you with this final provocative thought to really consider for yourself, your mom, your sister, or your partner. To spend a long time with your precious family, will you book a gynecological screening today? The reality of ovarian cancer is undeniably harsh, no sugarcoating it, but our ability to be proactive, that is incredibly strong. Thank you so much for joining me for this important explainer. Stay curious, stay informed, and most importantly, stay proactive about your health.